Naitwa Shukri Abdullahi, ndiye in charge wa hii hospitali kama medical superintendent. Karibuni sana leo. Hii ni Garbatula Sub-County Hospital, ni level 4 facility. In a catchment population ya about 20,000 people. It covers the whole Garbatula ward and also a referral facility for spiritual wards and kina wards. Kwa hapa services yenye tuna offer ni outpatient services na inpatient services. Kwa outpatient services we have MCH, we have the general outpatient clinics like MOPC, that is the medical outpatient clinic. We have the surgical outpatient clinics. We have the gynecology outpatient clinics and the general consultation. We also have the lab services, we have pharmacy services, we have radiology services. In our setup we have the X-ray and the ultrasound. Also we have the midwife ultrasound. Our X-ray also has the portable component where the patients who are very critical and cannot go to the radiology department are being done at the wards, in the wards or at the bedside. We also have immunization services, which is included in the MCH. And then the general inpatient services, we have the male wards, the female wards, and the pediatric wards. We have the maternity. For maternity, mostly it's about women who've come in labor and those who are expecting labor and those who have complications related to pregnancy. We also have theater services. In theater we have the cesarean section deliveries. In theater we have those biopsies which are being taken. We can also do surgical toileting. For specialist services or surgeries like orthopedic surgeon, we have our orthopedic surgeons in hospital, in the county referral hospital, and the ophthalmologists who come and assist us occasionally. So I think that's about it, the services that we offer. And this hospital is expanding because prior to this our radiology department was idle for some time because of personnel and equipment issues, but now it is fully functional. Our theater services as well, we had issues with the technical issues with the machines and the oxygen plant, but now they are sorted and it's already functional. Yes.
Are there best equipment here?
Yes.
Are they functional, all of them?
They are functional, all of them. In a day, we have the outpatient department, which is MCH, which is on its own, and the casualty and the outpatient department. So in a day, about 50, let's say 80 to 100 patients in a day. You see, according to KEMSA, we have the guidelines for essential medicines according to this level of the hospital. And the orders come directly from KEMSA. So whichever order we have, it's being brought by KEMSA. So, quarterly. Yes. Yes, it's enough because we have those, it's called buffer stock. So we also plan for ahead here for delays.
Are there cases of drugs expiring for
Yeah, that is usual, not only in this hospital, but all over. And there are SOPs regarding that, how to deal with expired drugs. So we cannot just say at this quarter that we expect these drugs to expire. No. Generally, what we do is the drugs, they are called short expiries, drugs which are near expiry. So we usually redistribute. So for the facilities around, they send them here for redistribution. And for us, when we have enough, then we send it to the county referral hospital for redistribution to the whole county, all facilities. Yeah. So we cannot stay with an expired drug here, and there's short expiry. There are guidelines, there are SOPs that deal with that. Man.
I don't know how this shop been affected.
As a facility, we cannot say it really affected us directly. But patients who come in and they want the services and they are not registered, that is now where the problem comes, and now they have to go and register and then they come. But now there are people, we have personnel, we have staffs who've been trained for that and they are assisting the patients.
Have there cases where you patient to go and register before they come back?
No. Tumepata some new staffs. We have 6 nurses, new nurses. We have 2 clinical officers wameongezwa, 2 radiographers na 2 health records officers. So now I think services will improve.
Referral Hospital. I'm standing in for the medical superintendent who is away for now, but also I'm doing hospital covering at the moment. I've been asked to come and talk briefly about the new structure that's behind us here. The hospital has been undergoing expansion for the last few years. Currently we have a new accident and emergency department that is almost complete, yet to be launched, with the only thing remaining are the pieces of furniture that are yet to be put inside there. The only thing we know, the new facility will increase capacity of the hospital, in that initially our accident and emergency department only held 5 patients, but now with the new facility the bed capacity has increased to 30. We'll have 10 extra beds for triage, and then 20 beds that will be taking care of the patients at that particular unit. The same structure is holding, is also housing the ICU and also radiology department. For the ICU, the bed capacity is increasing from 2 beds to 10, and for the HDU department, the bed capacity is increasing from 4 to 10. Say regarding that particular department, I think from there we also have the renal unit that is also up and functioning, helping patients from all over Isiolo County and also the neighbouring counties like Samburu. We also do have Marsabit, Wajir and others, and even Meru that is adjacent to us here. So we are serving all this region. The other thing I wanted to say is the CT scan machine that is also up and functioning and helping us so much. The other thing is maybe to say for the pharmacy department, we are receiving medications quarterly. I can't really give the good report of when we last received the last consignment, but we're receiving medication quarterly from KEMSA. Maybe to also add, we have an eye unit that is up and running. We are currently doing operations. We have doctors who are able to take care of patients around here. The other thing is we have a new clinic that was opened, that is a dermatology clinic that is also up and running. Maybe just to add, apart from that, we have the dental unit that is also functioning, mental unit towards the extreme end, maternity unit that is serving the entire region, maybe plus the inpatient that we already have at the facility. But as for now, we have 2 coolers that were acquired. For the 2 coolers, they're able to hold 8 bodies for now, but we are waiting for more machines to come so that it can be full to capacity as time moves. I think basically, do you have any questions with masks? The World Bank and also the county government, and we are happy that it will soon be open. That is the only thing I can say. And once it is open, it will give a facelift to this particular facility, and it will cause a change in this particular institution. The expansion will be big. That is the only thing I can say. It is up to standard. It is having quite a number of things in it. Maybe just to mention something else is that the hospital is acquiring a printer that will assist in printing files and also cards. That will help in obviously minimizing expenditure and such kind of things. Yes. Any other? The only thing that is pending, I want to believe the furniture in it. I think there was a proposal or program. I think this, if I'm not wrong, the president is yet to launch it, and also there was some things in between, things to do with furniture, and maybe 1, 2, 3 things inside there. Once they are done, I think the facility will be up and running. So basically, new mambo hiyo tu mambo ya furniture.